Okay, so welcome. Today we have Dr. Negin Riazi as a speaker today. So she will be giving us a talk about population health, and we're gonna have just casual conversation about it. She recently obtained her PhD degree at the University of British Columbia, and starting in February, she will be working as a postdoc at Brock University. So welcome, Dr. Negin Riazi, and I'm excited to have a conversation with you about population health today.
Well, thank you for having me. This is great.
Yeah, yeah, thanks for coming in. So do you want to introduce yourself in a way that you like to our students?
So hi everyone. As Young said, I recently completed my doctorate at the School of Kinesiology at UBC. Just really briefly, some interests. I love coffee. I'm a nature enthusiast, and living in British Columbia, we have access, to the water and the mountains, which is great. Granted, in COVID, that's been a little limited. And yeah, I'm an avid podcast listener. So if you're looking for some new podcasts, I would highly recommend 99% Invisible and Freakonomics, which are fantastic.
Nice, that's awesome. Yeah, and I'm happy to hear that you like coffee because that's one of my favorite food. I would say food. It's awesome.
Yeah.
Okay, so can you tell us a little bit about your disciplinary perspective and your training and also your research interest before we get into the topic?
Yeah, for sure. So my undergrad was in exercise biology at UC Davis. And once I finished that, I decided to go pursue my master's at Chico State University in California. And that was in kinesiology. And my focus was pedagogy. So I did actually quite a bit of work working with physical education classes, looking at goal setting in secondary school students. Um, and for my PhD, I really, I loved British Columbia. I loved Vancouver. So I came here to UBC and completed my program in the population health lab under the supervision of Dr. Guy Faulkner. And just to tell you a little bit about our lab's research, we kind of focus on two interrelated themes. So we look at the development and evaluation of physical activity and interventions. So like, for example, like what factors cause or prevent physical activity or inactivity and sedentary behavior. As well, we examine how participation in physical activity influences mental health. So physical activity and mental health are two big areas of research. And we also focus on how effective like population level physical activity initiatives are designed, how they're delivered, and how they're disseminated. So kind of getting into the knowledge translation piece of it as well.
Nice.
So yeah, I guess a little bit about my research. My research really focuses broadly on children's physical activity and the promotion of children's physical activity. So I focus on the first part, which my dissertation was really based on, was children's independent mobility. So this refers to a child's freedom to travel and play within their neighborhood or city without parental supervision. So something that we don't see a lot today, but was very prevalent a couple generations ago. And I also look at population level physical activity initiatives and policy level interventions. So I've done a bit of work with the Canadian 24-hour movement guidelines for children and youth, as well as the early years. So a lot of the projects I've been involved with focus on children's independent mobility, like active transportation and outdoor play. I guess one of my other big interest is in knowledge translation. And I have been involved in a couple knowledge translation projects. So for example, we did some work with the Canadian 24-hour movement guidelines, translating the early year ones into like a small animated video for dissemination. I don't know what else.
Yeah, that's awesome. It sounds like you have a really focused research interest in, overall physical activity, and independent mobility among children, but also by listening to what you have done throughout your PhD program, it looks like you have a breadth of knowledge in related to physical activity promotion and also population health. So
Mm.
it's really I'm getting more excited to for this interview, and yeah. So let's get to the next question.
Sure.
So to you, what is population health?
Yeah, so, epidemiology really looks at how disease is distributed within a population, right? And
Mm-hmm.
the factors that influence that distribution. So, to me, like a population health approach is really an approach to health that aims to improve the health of the entire population. Um, And the research that's done in population health is often interdisciplinary. So you are really thinking about, working with multiple different sectors.
Mm-hmm.
And it's not just, for example, kinesiology, or it's
Mm-hmm.
not just public health, but you could be working with individuals who, for example, are policymakers or are in built environment and
Mm-hmm.
can affect the environment in which, for example, a person lives.
Mm-hmm.
Um, and it really, like population health, really focuses on health outcomes of a group of individuals rather than looking, for example, at a single individual.
Right.
Um, like a doctor may see a single individual as a patient and treat them and try to improve their health, versus much of the research that we do is kind of taking a broad look at what are factors that could affect a large number of people.
Mm-hmm.
Um, and of course, like a population is defined by certain inclusion and exclusion criteria. So much
Mm-hmm.
of the research that I do, the population I focus on is often children and youth. And
Mm-hmm.
so I typically define that by a certain age range. So looking, for example, at elementary school students or children in the 8 to 12 age range. So each researcher will have a different population that they're focusing on.
Mm-hmm.
But you define that, but it's thinking beyond just the single individual and looking at a broad number of people.
Right. So instead of focusing individual, when we think about health promotion, population health approach is to think about population or a group of individuals when they strategize and when they plan for health promotion and healthcare.
Exactly.
Yeah.
And I mean, I would say, like, for example, you might do a research study where, you know, your sample might be like 100 people, but maybe
Mm-hmm.
100 people of like a representative sample. So you're looking at different SES, different, race and or ethnicity variables, that kind of thing. So maybe your findings are then generalizable to a larger population across Canada, for example.
Mm-hmm.
So I think going in with a mindset of like, how do we target the wider population?
Right.
So adapting to a wide array of settings. So what's the context that individuals live in?
Mm-hmm.
Thinking about disseminating the findings. So how do we, once we have the research, how do
Right.
we distribute those findings to the population?
Mm-hmm.
Also about implementation. So that's basically the process of putting these findings or decisions into effect. So how do we implement those findings, whether that's an intervention, like a policy, that kind of
Mm-hmm.
thing.
Mm-hmm.
And then finally, I think the other big part is surveillance. So are people, for example, adhering to guidelines? So Canada was the first country to release Canadian 24-hour movement guidelines. So moving away from separate guidelines for physical activity, sedentary behavior, that kind of,
Mm-hmm.
and sleep, to like a more holistic approach to guidelines. So that
Mm-hmm.
basically what's coming across is that if you're not getting enough sleep, you might not have the energy to be physically active. If you're on your
Mm-hmm.
screen a lot, that might affect your sleep and physical activity. So all these different movement behaviors are related.
Mm-hmm.
So basically thinking like, okay, so you have these new guidelines. Are people adhering to the guidelines? Do they understand the guidelines? Are whatever resources, initiatives, policies actually working? So that final piece I would say is like the surveillance piece.
Right. Nice. So,
Mm-hmm.
so just to summarize, I guess population health, the essence of it is that the approach is to focused on populations, not individuals, and also it requires holistic approach where it's just not one aspect of research, but it's surveillance, it's development of, for example, 24-hour movement guidelines, public-facing information for knowledge translation. So it sounds like it touches on the entire process
Mm-hmm.
for health promotion at
Yeah,
the population level.
exactly.
Yeah, that's great. Thanks for that explanation. It's really clear. So now moving on to the next question. I know that you are in this population health field for a long time, and you just gave us a description of what population health means, but do you have any other examples or the research exhibit that you want to share with our students?
Yeah, so I'll talk a little bit about some of the like types of study designs that I've used and whatnot, and
Mm-hmm.
then I'll jump into the research exhibit.
Sounds good.
So I believe later in the course you'll be covering like different study designs, right?
Yeah,
So I'll briefly touch talking about literature reviews, like systematic reviews and cross-sectional studies, because
yeah,
that's what I've used.
yeah.
Um, so often when we are starting a new study or like new research, we'll go about doing a search of the literature first to see
Mm-hmm.
what has been done so far and where the gaps in the literature are. So that we're not like repeating research
Mm-hmm.
and we're
Mm-hmm.
looking to fill those gaps in the research. So, no one's done whatever study this is or hasn't looked at this population or hasn't looked at this context or setting. That's what we want to fill so that we have a better understanding about whatever topic it is.
Mm-hmm.
um, so I think literature reviews and systematic reviews are like a crucial part of the research process because
Mm-hmm.
what they do is they really synthesize and bring together what has been done and it shows where those gaps are.
Mm-hmm.
um, Additionally, some of the work I've done is working in cross-sectional studies, which really provide kind of like a snapshot of what
Mm-hmm.
conditions are at the time of the examination. They're not longitudinal, they're not over time. They're, for example, you send out a questionnaire, someone answers it, and at that time, for example, they're getting this much sleep, this much physical activity, this much screen time. So we know that at that point in time. But what's really good about cross-sectional studies is that they're really useful in determining if associations exist between independent and outcome variables. So,
Mm-hmm.
what factors are influencing your outcome variable? Um, and they're also really helpful for population level kind of research because you can do them and you can do it with a large population. So
Mm-hmm.
I consider myself actually a qualitative researcher. So I do a lot of focus groups and interviews. And there is so much data that comes out of that. Granted, it's fantastic and it's very rich data, but the fact is, you can't really do 1,000, 2,000 people, like
Mm-hmm.
interviews with them to, get these transcribed verbatim and to analyze them. It's a lot of data. But with a cross-sectional study design, where you're sending out like a survey to 2,000 people,
Mm-hmm.
you can collect that data and analyze it quite easily. And you get a
Mm-hmm.
lot of information. So especially for, population level initiatives and research, this is great. Um, I guess the other thing would be to think like quantitative methods are just, they're quite useful because It allows researchers to really study the large population. They can test and validate like existing theories. And you can, because you have such a large sample, you can potentially generalize those findings to the broader population.
Yeah, thank you for the description. Just now, you touched on all the important, like most of the important topics in this course, so it's awesome. There's a link, obviously, in across topics, right? So, and as you said, with qualitative research, of course, there's a value associated with qualitative research that quantitative research cannot fill in. But quantitative research, like cross-sectional studies, you can collect data that could be generalizable in a broader population. So that's one of the benefits of using population-based sample for population health research, using the cross-sectional research design. And also we can use other study designs as well, like cohort studies or so longitudinal, prospective, retrospective, case control. There's RCT and there's community trials. So there are other study designs that can be used in population health. But when we think about convenience and cost effectiveness, cross-sectional study design makes a lot of sense.
Yeah, exactly.
Yeah, well, thanks for that. So yeah, you've given us a really good information that we can take on. But do you want to give us more concrete examples of what population health research look like?
Yeah, sure. So I will actually talk about some of the research that I've done for my dissertation. And I guess I have like 2 research exhibits because they all came about from the research that I did. So I'll talk about a documentary that we made, as well as an article that we wrote for The Conversation, which is kind of like a online news website, but it's written by academics. So like if you have a master's, a PhD, that kind of thing, you're the writer. So you really provide like evidence-based or research-based findings in a way that is very tangible for the general population. So let me just get this. Let me just share my screen with you.
Sounds good.
Fantastic. Okay, so just to define KT means knowledge translation. So when I'm writing KT project, this is basically the result of what came out of the research that we did. So everything that I just spoke about, this is what I did for my dissertation. So one of the first things that I did was a systematic review. Again, so this was a synthesis of the literature, and we were looking at examining correlates of children's independent mobility. So the factors that influence independent mobility. And I took a social ecological approach. I'll talk about that a little bit later. But basically, I was not just looking at individual level factors. I was looking at, the interpersonal level, social level, built environment. And basically what we found, we included 43 articles after, doing all these database searches and narrowing it down based on a set of inclusion and exclusion criteria. What we found overall was that there are significant correlates, so significant factors at every single level of the social ecological framework that influence children's independent mobility. So this goes back to the idea that you need multi-sectors and multi-levels need to be addressed if you're thinking about like trying to promote independent mobility or create interventions that affect independent mobility. I guess the next one, we did a cross-sectional study. So this was, it was part of a larger study called the Active Transportation Independent Mobility Study, so ATIM. It was a multi-site study. So we were based in Vancouver, Ottawa, and Trois-Rivières. And we were looking at children within the 8 to 12 year age range and their parents. And so when we did the sampling for the study, we looked at varying sites. So as I said, those 3 sites, we looked at different urbanizations. So looking at urban, suburban, and rural environments, and as well as varying the socioeconomic status. So looking at high and low SES. So what we ended up with after, it took, I think, almost a year of recruitment throughout the year and whatnot. But we ended up with 37 primary schools and nearly 1,700 participants. And there we go. So what we found again was that there were differences with regard to factors, and these factors were significant again at every level. So children's age, children's gender, looking at how parents travel to work, or parent gender also affected it. But what we found, like the biggest finding, was that where a child lives matters. Basically, overall, children across the 3 regions that we looked at had very low independent mobility. So on a scale of 1 to 6 on an independent mobility index, basically the average was like 2.17 or something like that. But it was in the 2 range, so very, very low. But what we did see was that children in Vancouver and Ottawa had less independent mobility than children in Trois-Rivières. So whether that has to do with the size of the city, like population density, whether that could be a cultural factor, there are differences there. And the other important fact that we saw was that regardless of where a child lived, the perceptions of the environment with regard to safety and with regard to concerns around traffic and stranger danger and crime, these were, it was, like across all 3 regions, these were concerns. And so that really negatively influenced the amount of independent mobility a child had. So basically, we did these 2 studies. I'm not going to talk about my qualitative study, but that I did a qualitative study after this, focusing on the greater Vancouver area, and talking to families about, their, parents' independent mobility growing up, and what what their concerns were about their children's independent mobility, and looking at how independent mobility was negotiated within families. So as I've said, like systematic review, cross-sectional study, qualitative study, and it really provides, they go hand in hand, and each of them have their strengths. And I think they provide a much better picture of children's independent mobility. So I will just go ahead, and after doing the systematic review and the cross-sectional study, we kind of got to the point of like, now what? Like, how do we disseminate the findings? So should we do like a podcast? Should we do like an infographic? Should we do an animated video? And what we ended up thinking about is, why not do a documentary? Because, then we're showing real families, and, using the findings of the systematic review, so the greater literature, what has already been done, and then what we found in our study. So we created this documentary, and we actually had a documentary premiere, I believe, if I remember correctly, September 18th, 2019. So it's been out a while, but it was a great opportunity because this allowed us to introduce the documentary to the public. And there was a panel discussion with a few experts in the areas of risky play, in the area of like families. So the panel discussion also helped us get get the audience's thoughts on what they thought about it. But also it was an opportunity to not only showcase the findings of our research in hopefully a more engaging way than just a journal article, but it was great to also answer questions of like parents and teachers and like even students that had come to this event. So another thing that came out of this premiere is that they turned that panel discussion with the questions and everything into a podcast as well. So that was another KT product that came out and can be accessed by, it's free. It's it can be accessed by pretty much everyone. And I think one of the things with regard to journal articles is that oftentimes, yes, we publish them and they're free to access. But, if you're not associated with, for example, like a university, oftentimes, an article could be $50, maybe even more, to access, which, that is a barrier to us disseminating findings to the general public. So moving on, another thing that we did was write an article for the conversation. So this was basically an 1,100 word, summary of what we found. So we talked about, anything from, like the COVID-19 pandemic, what that means for children's independent mobility. We gave a bit of findings with regard to what we found from the ATIM study. And then at the bottom, we kind of gave some, recommendations or 6 steps to helping build your child's independent mobility. So we tried to tailor it to, tailor it as well as write in lay language, what those findings are. And let's see, I guess one of the other things I wanted to bring up is that knowledge translation piece, if that's okay.
Yeah, sure. Go ahead.
Yeah, so knowledge translation, as I said, is basically taking the findings and translating it into a format that is accessible to the people, or the knowledge users, so the people that need it. So in research, we identified our problem, our research, the question, or whatever purpose it was. We conducted that, and we synthesize. Oh my goodness gracious!
Oh yeah.
The literature found those research gaps, and we adapted our knowledge to the context. So who was our audience? What was the medium that we were delivering, and who were the messengers? So, for example, our audience for a lot of independent mobility research is, parents, because parents are oftentimes the gatekeepers of, to their children's, and they have such a big influence on what children can or cannot do, and whether or not they promote physical activity, whether or not they promote independent mobility. And then we chose our medium. So we did like a documentary, we did that podcast, we did, the article. And, then also thinking about your messengers. So who is helping spread the word? Is it like, a public health agency of Canada? Is it like a government, entity? Is it, early childhood educators? Is it teachers? So thinking about who you can partner with to really get that message out there. And then implementing that KT product and tool. So going back to what I was talking about a little bit earlier, is talking about like evaluation and surveillance. So monitoring that knowledge usage and evaluating the outcomes. So like, is the KT project, product, tool, whatever you created, is it actually working? So one of the things that we did, because, this went out to the population, we wanted to see like, does this documentary even do anything? So what we did was we created a short questionnaire. And so like the documentaries on YouTube, underneath it, we have like a link to a questionnaire, which basically gets at, did you learn something new? Did you even know about independent mobility before this? But kind of trying to get at like awareness. Was this product effective? Did we raise awareness? And of course, we have YouTube analytics. So like you get quite a number of like the views, what countries they were from and whatnot. So that was very, very helpful. Additionally, for the conversation article, we had, the conversation itself provides a platform for authors to see how many, views you get. So I think recently this says like the article had 10,398 readers,
Wow.
like it was shared on Twitter. And, obviously other articles may have done better, but like considering the fact that if, our journal article on the ATIM study probably does not have this many views. So it's really, I think, helpful to think about like how to get your message out there.
Mm-hmm.
Yeah.
So thanks for sharing this. It's amazing, and you've touched on so many important topics that will be covered or that has been covered in this course. So it's awesome that we can have that link between your interview and others' interviews. So I guess population health is not just conducting a research on the population. It's about how you translate that knowledge into the population that you're serving.
I don't know if everyone would agree with me, but I think it is extremely important, even
Mm-hmm.
as a researcher especially,
Mm-hmm.
that you are thinking past just doing the research and publishing the findings in a journal. Because
Mm-hmm.
in reality, the number, academia or researchers is a very small population, and they are the ones who have access to it. So I think it's really important to think beyond that and think, okay, so you found all this information about physical activity or, independent mobility, but who needs it? Like, what
Mm-hmm.
can teachers do? What can parents do? And how can we, even creating, like, you don't have to go and create a documentary. You can create like an infographic that
Mm-hmm.
like really simplifies the process of how all this works, the interconnections between all these different levels. Um, so I do a lot of work with this social ecological framework. So
Mm-hmm.
basically, what this framework does is it emphasizes the dynamic interplay between these multiple spheres of influence. Going back to what I was talking about, like children's independent mobility, you have these individual factors,
Mm-hmm.
like children's age. So the older a child is, the more independent mobility they have.
Mm-hmm.
Oftentimes, boys have greater independent mobility than girls. Like moving on to the built environment. For example, does the child's neighborhood have sidewalks? Does it have proper lighting? Does it have traffic calm areas? Additionally, like policy environment. So are there policies to support the movement behavior, whatever it is? It could be physical activity, whatnot. But like, for example, in Utah, they
Mm-hmm.
actually, a couple years ago, I think it was 2018, they passed a free range parenting law. So what they did was they actually went in, it's not a new law, they just changed the definition of neglect so that parents couldn't get in trouble for letting their kids go out independently to play or to travel. So, like in the past, that could have been considered neglect. So, the
Mm-hmm.
policy is now supportive of these behaviors. So, if you're looking at population level, affecting the population level, you also have to consider the context in which people are living, where children are living,
Mm-hmm.
and to realize that it's not just all about the individual. A lot of like health promotion in the past used to be centered on what can the individual do, but
Mm-hmm.
it's really important to also consider, well, the environment really impacts, and the social norms and the policies, they all impact that behavior. So I think it's really important to also consider that as well.
Mm-hmm. That's really good that you brought it up because socio-ecological modeling is it's a popular modeling, and also I use that in my research all the
Mm-hmm.
time. So when we think about, for example, promoting physical activity, it's just not about one level of effort that will make the change. It's the like you said, multi-sectoral, multi-level, comprehensive and holistic efforts that could help us to reach the goal of promoting health, population health, promoting physical activity at the population level, etc.
Right.
Yeah, so yeah, that's great. Um again, I would like to say you've touched on so many important issues and you've touched on so many topics that we're going to talk about in this course, the key topics. So I really appreciate it.
No
Is there
problem.
anything that you want to say to our students to enlighten them?
Enlighten. That's
Or
that's a
just
hard one.
yeah, or just something that you want to say?
I guess what I'd like to end with is like, I want to challenge the students. So, those of you listening, to think past just publishing in journal articles or just doing research and just ending it there, but to really think about how to get that information into the hands of individuals who actually need it.
Mm-hmm.
And additionally, to think outside the box. For
Mm-hmm.
example, a journal article might be perfect, but for example, an infographic might be perfect for the population you're thinking of. So
Mm-hmm.
think about your knowledge user and think about what works for them. So whether, for example, if you're targeting new parents, there are so many mom groups, there are so many apps, design things that are relevant to the population that you are looking at. And I think that's really important when you're thinking about population health and applying research to that population.
Mm-hmm. Mm-hmm.
Yeah.
That's great. So the final assignment for the students in this course will be developing an infographic based on an epidemiological
Awesome.
study. So yeah, it looks like you know the course.
No, that'll be fun.
Yeah.
It's good to be creative and to,
Mm-hmm.
try a different format than what you're used to, for sure.
Yeah, and thanks for sharing all the resources, the documentary, and the conversation article. Our students will be reading and watching those resources. So I really appreciate sharing those resources and your knowledge today. And yeah, thank you so much.
No problem at all. Thank you very much for having me. Bye, everyone.
Okay, thanks.